In this video, we will learn what is paraphimosis and what problems can paraphimosis cause, why does paraphimosis happen, and what is the effective immediate and the long-term treatment for paraphimosis. Hello friends, welcome to my YouTube channel. I am Dr. Vijayan Govinda Gupta, a urologist and an andrologist in New Delhi who specializes in surgical treatment of male sexual problems. The topic of discussion today is paraphimosis. My video on phimosis or tight foreskin can be seen here. Paraphimosis means that a person with phimosis or a tight foreskin has ended up retracting his foreskin to such an extent that the foreskin has now come and gotten stuck behind the glans. Ideally, the foreskin in uncircumcised men should be easy and loose. The foreskin should be able to retract back and front easily. There should not be any pain to the patient, and the foreskin should be able to go back and front easily in both erect and non-erect conditions. But if the foreskin is tight, the area is very tight and the foreskin becomes wide and scarred, then sometimes these patients may end up with pulling the foreskin behind the glans. As you can imagine, it forms a ring-like structure behind the glans and the foreskin is not able to come ahead or is not able to be pulled ahead of the glans. Now, what are the problems that this can cause? First, since the foreskin has now gotten stuck behind the glans, it prevents the blood flow and this can lead to necrosis and lead to infection of the penis. Second, this foreskin ring can cut through the penis and cause deep wounds in the penis. Third, it may lead to pain and swelling. Fourth, it may lead to severe sensitivity and problems for the gentleman. Paraphimosis is a true surgical emergency. There is no medicines or any ointments that you can apply to reduce paraphimosis. If your tight foreskin has gotten stuck behind your glans head, then you will need to visit a surgeon in an emergency setting. The surgeon will most probably reduce the paraphimosis. What that means is that he will cut the ring, and once the ring is cut, then he moves the skin back. There are certain conservative or non-surgical methods like application of glycerol, reduction of swelling, use of hot water, but these are better to be utilized by a medical professional under supervision. Once the paraphimosis has been reduced, it may take you 2 to 3 days for the swelling, sensitivity and pain to go. But if you have had one episode of paraphimosis, then you have to be extremely careful that you do not pull the skin back and you immediately undergo a circumcision. A circumcision is basically a surgery in which the tight part of the foreskin is removed. In New Delhi, India, I practice something called as partial circumcision, in which instead of removing the entire foreskin, we just remove the tight component. So after the healing has been complete, you still have enough foreskin to cover your glans. Partial circumcision has been made possible because of the revolutionary device called as ZSR circumcision, which is a stapler method utilized to cut the foreskin, which provides a sutureless and a stitchless, bloodless, painless method for circumcision. So if you have paraphimosis and you are suffering right now, I would advise you to go to a doctor immediately and get it reduced, and then you can always come to me to get your stitchless ZSR circumcision done in New Delhi, India. If you like this video, kindly like this video, share with your friends and subscribe to my channel, because in this channel we usually provide interesting or difficult urological topics. We cut them down or break them down into simple to understand format and present it to my viewers so that they may understand the medical problem in as simple terms as possible. Thank you for tuning in.